On to Health Matters. Today we are talking about health, from heartburn and bloating to nagging discomfort. Important. A lot of us brush it off, thinking it's just something we eat, but the truth is issues like gastritis and indigestion can be signs. Bust a few common myths and explore simple ways to support your gut health every day. Joining us for this important conversation is Dr. Nelson Makemba, medical professional with years of experience in internal medicine and digestive health. Good evening and welcome to Daily Roundup, Doctor.
Good evening to you, and good evening to our viewers.
All right, just to start off, Nesha Medical Practice is focusing on digestive health this month. What inspired this campaign around gut awareness?
Yeah, what tends to happen is that we see quite a lot of gut-related issues, at the primary healthcare levels. And also now that we are in winter, sometimes, our diet shift, we are eating more rich, heavier, stew type of a food. That can be strong on our digestive systems. We are exercising less because we are indoor and it's a bit cold outside. Our immune system can be a bit weakened as well. Winter blues and stresses can kick in as well. That might also affect our gut health. And also what tends to happen really, our circulatory system tend to divert circulations to vital organs to keep them warm, and less circulatory to the gut and the stomach and the intestine. So maybe that also might end up affecting motility and, peristalsis and the movement of food in our gut system. So, these issues might also tend to be on a rise, especially this time of the year.
Might be the one of the person that ignore those signs.
Yeah.
Yes, but just say, they say that the gut is a powerful communicator. What are some of the early signs that our digestive system might be sending to us and we are ignoring it?
Right. I mean, if you find yourself having a lot of bloating and your tummy is feeling gassy all the time, pain, especially in the epigastric area, recurrent either constipation or diarrhea, these are probably nausea and vomiting as well. And you might even have unrelated presentations where your mood swings are always off, skin is flaring up, getting all kinds of rashes. All of this stuff might be, a telltale sign that something is up. And if you're experiencing such common occurrences and presentations, it's advocated for that you get to have yourself evaluated.
And gastritis is one of the key conditions we are focusing on. Can you break down what it is and how it is typically presents in patients?
Yeah, gastritis by definition is basically inflammation or flaring up of the mucosal lining, particularly that lines the stomach and the first part of the small intestines called the duodenums. The kind of presentation that you typically find, patients presenting with is epigastric pain. It's bloating or feeling gassy all the time. They might be nauseated. They might present with vomiting. They might have an abdominal pain. Decreased appetite, and some might even present with hiccups. Yeah, these are the kind of sort of typical presentation that we tend to see, presenting with these patients that are having gastritis, particularly if they've eaten maybe food like spicy, they've had a fizzy drink or some sugary type of, food and fatty food, and they tend to often present with this kind of presentation. Also, if they've consumed a bit of alcohol.
I see.
Yeah.
And what lifestyle or dietary habits contribute to most poor gut health, and what simple changes can people start making today?
Yeah, individuals that eat a lot of spicy food, individuals that eat a lot of, fatty food, fizzy drinks, a lot of processed food, so to put it, tend to present quite commonly with these kind of problems. Consumption of alcohol as well. Even worse if an individual smoke. Stress might also flare them up. So a small adjustment like, exercising, staying well hydrated, eating a lot of fruits and vegetables and food that is rich in fiber as well, to improve movement of food in your digestive system. Go a long way in improving some of this kind of presentation that we tend to commonly see.
And there's so much confusion about gut-friendly foods. Could you share some myths, busting facts that people should be aware of?
Yeah, probably things like not all fermented food, are bad and not all are good. Maybe yogurt might be a good one. Probiotic is a good if you consume food that is rich in fiber, that is good for you, but excessive amount of fiber also can cause you bloating and gaseous type of distension as well. To have, things like apple cider is good for your tummy, yes, but, excessive consumption of that also might cause all kinds of problems. And if individuals really, just, get to be given to eating, balanced diet, making sure that they are well hydrated. Exercises can go a long way. Cutting down on alcohol consumption, and smoking is not good for anybody. We advocate that those that are probably smoking, if they can consider stopping altogether. All of these things might go a long way in helping them restore their gut health.
Doctor, is gastritis also common in children?
Yeah, children do present with gastritis as well. It's just that obviously the kind of clinical presentation that you might get depending on the age spectrum might vary from, the age group. A small child might just often have a colicky, type of abdomen. They might always be, having pain when they feed and stuff of that kind. So it does present in children as well. One just need to be very, cautious in how you go about managing children, because their kind of clinical presentation might differ from us as adults. Yeah.
And doctor, can one get cured from gastritis? I know you mentioned some few points earlier on that as well.
I wouldn't really want to use the word cure per se, because if your gut is sensitive and that mucosal lining of the stomach and the first part of the small intestine called the duodenum, but what rather might happen is that you can lead a symptom-free lifestyle if you, take care in terms of the kind of food that you eat, and if you do follow through with, the kind of guidance that your clinical, consulting doctor is, giving you. And if you make those small readjustments we have highlighted to earlier, you can actually live a life where you don't have the symptoms of the bloating and the gassy tummy and the pain, But as soon as you might start having food that are not necessarily good for you, the symptoms might reoccur. Yeah.
Perhaps just any final remarks, and also if people can visit your medical practice to come and get free medical advice.
Yeah, definitely. We are here to definitely assist anybody that is willing to make use of our services. In conclusion, really, all I want to say to everybody watching us tonight is that just eat your food as medicine. Otherwise, you might end up eating your medicine as food. So you are eventually what you eat. Be given to eating, and consuming food that are actually healthy for you.
Thank you so much for being on Daily Roundup this evening.
Thank you for having me. It's always a pleasure being here.
Okay. That was Dr. Nelson Makemba. He just gave us a brief on digestive health that they are promoting, that is at Nesha Medical Practice. We'll be back.